Now, to bring us into this episode, I'm going to start by asking you a question, and I want you to be honest. You do not have to share your answer with anyone. This is for personal reflection. Have you ever looked around your organization and said to yourself, I know there are people here, other than me, who are working on health literacy initiatives in some way, but I don't know who they are. I don't know where they sit across the organization, and I don't know what exactly they're doing. I just feel like there has to be someone else. I have been in a situation where I've asked myself that before, and there are two main responses to that question. There's the response that says, you know what? I don't know that information, and I'm going to figure it out because I want to coordinate these efforts. Then there's the other response that says, I don't know this information, and that's just going to have to be okay for now. It's going to have to suffice. I'm just going to continue to do my own thing over here and hope that it has some type of impact. And to be clear, there is absolutely no shade at all if you have ever said to yourself the latter response, because it can be a significant undertaking to coordinate efforts across, especially a large organization, but honestly, any organization. That is a significant load that you would be taking on in order to do that. To even know where to start, you have to know what you're working with and where those initiatives might sit, who those owners might be. And so today we're going to spend some time uncovering the places where health literacy is hiding. Maybe it's hiding pretty well, or maybe it's hiding in plain sight in your organization. We'll also, in part two, talk through some actionable ways that you can increase connectedness between those areas, those departments, in order to improve that connectivity between health literacy initiatives. So that'll be in part two. But today in part one, we're going to focus on uncovering those places where health literacy is likely hiding. First, if we haven't had the chance to meet yet, my name is Megan Freeland. I'm a public health pharmacist by background, and my work touches on a blend of public health, health equity, patient engagement, and health literacy. To start out, I'm going to share 7 non-obvious places where health literacy initiatives might be hiding within your organization. And I understand that I may be speaking with leaders from hospitals and health systems. Some of you may be in clinical practices. Some of you may be in biopharmaceutical organizations. So adapt the language for your particular organization's needs. But across the board, here's where you're going to find health literacy initiatives hiding out. First and foremost, care and clinical departments. So whether you are working as a clinician within a particular service line, or you are thinking about a pharmacy department, these are places where clinician-led health literacy initiatives might be found. Another department where you'll find health literacy initiatives are in your marketing and communications departments. A lot of times there are segments of these teams who are communicating directly with patients or consumers. They are likely incorporating health literacy concepts or ideas into their work, sometimes without even realizing that that's what they're doing. So your marketing and communications departments are going to be prime spaces for health literacy initiatives. Another space is patient services. Patient services is sometimes a catch-all for anything that has to do with the delivery of care to patients and the operations around that delivery. Sometimes it is easy to think of health literacy only as education. Health literacy is not just empowering patients to be able to find or use or understand health information about a disease state per se. If they are needing to understand health information, that information could be navigational. Like, how do I set up an appointment? How do I use my insurance to cover this care? How do I find the right building that I'm supposed to be in? It can also be around utilization of health services, knowing what types of services are available. Along those same lines is patient experience. Patient experience actually holds a lot of weight when it comes to health literacy because and we're actually going to talk more about this after part 2 of this episode. Patient experience and health literacy are like this. They go hand in hand. And you actually see that reflected in the data that patient experience specialists use to get a sense of patient satisfaction within a particular organization, oftentimes a hospital or a health system. So patient experience oftentimes is holding health literacy initiatives in their hands as well. Also, patient engagement and advocacy. These are going to be spaces, especially in biopharma, where there is dedicated engagement with, activity with, outreach to, community with patients, advocacy groups, etc. And these departments are oftentimes creating or extending health literacy initiatives to or through those patient advocacy groups and those patient populations. Similarly, you also have community engagement and outreach departments, especially at hospitals, health systems, that are engaging with the community as well, perhaps in a different way than biopharmaceutical companies are engaging with patients, but through similar methodology in terms of actually showing up in the community and being present and being responsive to patients and community members' needs. If you sit in that space and you're trying to be more responsive to the needs that you're hearing coming up from your community, health literacy is likely one way through which you're doing that. And then, of course, health equity is a space where health literacy is very closely aligned. Health literacy, I like to say, is one of the ways that we operationalize health equity, and we actually bring it to life out of the abstract and out of the theory into actually impacting communities. So those are the 7 spaces where health literacy initiatives may be hiding in your organization. If you have thought through this conversation of other areas where you've seen health literacy initiatives sit, I would encourage you to drop those in the comments. Again, this podcast is a space where I hope that we can learn from and share with each other. So please feel free to share your experiences as well. Now, ideally, even though we have multiple potential owners across all of these departments, ideally we're working from a common and core set of messages or from a common and core goal. In reality, we know that it's probably not happening. And it's largely because of this fragmentation that is the case. Now, here's the challenge with fragmentation. You can think about it like body parts. If body parts are acting with no brain, or if my right hand is doing something that my left hand has no idea about, right? How could they better be working together? The risks of not working together are we're duplicating work, so we're being much less efficient than we could be. We are utilizing our staff resources, our time resources, our financial resources on work that is already being handled by another owner or another department. We also, and this is a huge one, we also risk sending mixed and conflicting or confusing messages to patients or to those end users, patients, caregivers, families, visitors, whatever label you want to place on it. Because again, without that coordination, you might not have coordination of messaging either. I'll share a real world example. I was scheduling a mammogram recently. This is not my first mammogram. I've been getting them for several years. The instructions that I was given on the phone when I was scheduling the mammogram, I wrote them down. I wanted to make sure that I knew how to prepare for my appointment. The instructions I received on the phone were different from the updates that I got when I checked my patient portal. Those instructions were not quite the same. They were similar, but they were not exactly the same. Okay, so I had a level of confusion there about what I was actually supposed to be doing as a patient and how I should be preparing for this appointment. So then I go online to the hospital's website to see if their women's center or the mammography center had some specific instructions there. I found no information there. And for me, as a pharmacist, as a health communicator, I kind of know how to navigate this situation when I'm getting mixed messages, and I know how to figure out exactly what I need to do. But for a lot of people, one of the next steps would be, well, maybe I'll just go to another health system's website and see if they say anything about how I should prepare. And then now you're risking getting 3+ types of conflicting messages and not knowing what you need to do as the patient. So that leads to questions like, well, how is the scheduling center or the call center interfacing with the digital marketing team? Or how is the digital marketing team interfacing with the team who develops and sends out messages to the patient portal? How are all of these departments coordinating so that patients don't suffer from that fragmentation and from those conflicting and confusing messages. So that's a huge risk. And then overall, the one big risk that is being propped up by this fragmentation are missed opportunities to improve patient outcomes. If my right hand is doing something that my left hand is unaware of, and if we're actually doing the same thing but in different ways, I would argue that there is much more power and there's much more potential progress if we are working together toward a common goal with more awareness of what we're all doing. So, the idea of number one, identifying related opportunities across departments, and then number two, coordinating across departments is not to create more work. Let me be clear. The point is not to create more work. The point is to connect existing work. It's very likely that your organization already houses some tremendous health literacy initiatives. The next step beyond having great initiatives is to have great connectivity and coordination between those initiatives so that there's a more systematic approach to incorporating health literacy into the fabric of your organization and strengthening organizational health literacy in that way. And to do so in alignment with our North Star, which of course are always patient outcomes. So again, in part two, we're going to dive deeper into ways that you can actually actualize this process of coordination. But for now, I would love to hear if you have any thoughts or perspectives on how fragmentation of health literacy across your organization either impacts your work, impacts patient outcomes, or if you have tried successfully or unsuccessfully ways to increase coordination across departments for the benefit of health literacy in your organization. I would love to hear those as well. As always, thank you for listening to the Health Literacy in Real Life podcast. Please subscribe. And if you know of colleagues, fellow health leaders, life sciences leaders, public health leaders who are working to strengthen organizational health literacy, please feel free to share this podcast with them. And I look forward to seeing you for part two. Remember that if you or someone you know would like to be a guest on the podcast, you can always complete the podcast guest recommendation form, which will be linked down below. We'll see you next time.